Jeffrey Gelgut. I work as a healthcare consultant. I run primary care networks across the province of Ontario. I've helped physicians over the last decade and a half transition and embrace primary care reform and move into capitation-based payment programs. I'm finding of late that morale is at an all-time low. Physicians' reluctance to come together and support the new initiatives are the goodwill has almost been completely obliterated by the proposed cuts to the fee schedules. And the bottom line is that physicians are feeling extremely threatened by the lack of democratic process with respect to these imposed fee cuts. Physicians are small business operators. They have huge infrastructure costs. When the health minister said or projected that the average physician is earning $385,000, what was not taken into account were infrastructure costs, overhead costs. Up until very recently, physicians could expect to pay anywhere from 40 to 50% of their earnings to support their overheads. It is my belief and the belief of many of my clients that as a result of these cutbacks that citizens of the province will suffer as a result of the increased patient loads and the likelihood that physicians will have to reduce their office staff and their front office staff and their nurses because they simply won't be able to support the infrastructure of their offices. I have placed hundreds of physicians in networks. I used to be inundated with phone calls from physicians from other provinces looking for opportunities in Ontario. Those opportunities over the last 3 weeks have been completely obliterated by the impending cuts to our healthcare budgets. I think the citizens of Ontario have to appeal to our health minister to re-examine her decision-making, the decision-making process. I think it's time that the physicians and the OMA and the government come back to the table to negotiate a fair settlement. Doctors are prepared to hold off, to accept certain wage freezes, but the realities are that within these cuts, the expectations are that physicians will continue to look after greater numbers of patients. We have an aging patient populations. The demands of the aging patient populations will not be able to be supported. People will be forced to endure greater wait times. People will suffer waiting. People will go blind waiting. People could potentially die waiting for essential services that are slated for removal. Again, I would appeal to our health minister to get back to the table to negotiate a fair settlement with the doctors of this province who are very motivated, who are very willing to come to the table, and I would ask that that process start now. Thank you.